morning everyone. Breast cancer awareness is a global effort to raise the awareness about breast cancer and promote early detection and treatment. Early detection cures the disease almost 99%. Therefore, we will talk about how to detect early and do something about it. Now, first of all, we have to know what are the risk factors for having breast cancer. Being female is an important risk factor. 1% is present in males also. Obesity, alcohol, use of tobacco, other use of hormones, postmenopausal females who are using hormone replacement therapy, and some risk factors like early menarche, having periods at very young age, or periods which are not stopping by 55. They are the risk factors. One has to know what are the signs and symptoms before you can detect it. So signs and symptoms can be lump present in the breast, or it can be dimpling, puckering, or any kind of changes in the skin, any bloody discharge or white discharge from the nipple, or any armpit lump is present, any changes you are noticing in your breast. You have to see your gynec to see if there is any problem. Now, what to do when you know you have the symptoms? Early detection only saves life. There are 3 pillars for the early detection. One is the self-breast awareness, clinical breast examination, and mammogram. Now, breast self-awareness is very important for all the females because they should know what their breast looks like and how to examine their breast. Now, after 20 years of age, every woman should examine their breast after the periods. 5th day of the period stop, the bleeding stops, examine your breast in the shower or lie down. You can examine your breast while standing or lying down. Always make sure that you examine your breast properly from above to down and from inside to outside. Examine your armpit also. I'll show you here. You have to use these 3 fingers. The pads of these 3 fingers are used for examination. Don't tick like this or don't examine like this. This is the wrong way of examining. These 3 fingers of right hand for the left breast and these 3 fingers pads of the left hand for the right breast. So it has to be done like that. Now for this, you have to examine right from your collarbone up to down like this and gently, firmly going deep, and then examine the whole breast tissue till down also and the underarm area. Go in a circular motion or go from up and down. In the end, examine the nipple area and the skin around it, which is called areola. You can see, examine it. See if you feel any lump or any abnormality there. Then expel any nipple discharge or anything from the breast which is coming, which is very important. So all the females should examine their breasts themselves and get yourself examined your breast by any doctor once in 3 years till 40 years. The third most important is the mammogram, which is advised after the age of 40. Till 50, do it every 2 to 3 years. After 50, annual. It's a part of an X-ray in which the breast tissue is compressed between the 2 plates, and any present abnormality, calcification, or any lump present in the breast is picked up easily by the mammogram. So mammogram is very important because it helps in early detection. And early detection means it can save the extensive surgeries, chemotherapy, limited radiation, limited financial costs, and actually it is giving the life to the patient. So we all must go for mammogram after the age of 40. Be aware, spread awareness. Take the pledge to have a healthy life and pledge mammo.